Here are the top stories for today, March 24, 2020. The House and the Senate approved the granting of special powers to President Duterte to help stop the spread of COVID-19. Malacanang urges government officials not to use their clout to get ahead in COVID-19 testing. And the WHO says coronavirus disease is largely transmitted by symptomatic people. And a psychologist stresses the importance of maintaining relationships during quarantine. Good day, I'm William Theo. Welcome to the PNA Newsroom. The House of Representatives on Monday night approved on third and final reading a bill declaring a national emergency and granting President Rodrigo Duterte additional powers to address the coronavirus pandemic in the country. The chamber approved House Bill 6616, otherwise known as Bayanihan to Heal as One Act, with 284 affirmative votes, 9 negative votes, and no abstention. The bill authorizes the President to exercise powers necessary to carry out the proposed national policy for a limited period and subject to restrictions, therefore allowing him to adopt and implement measures to minimize further COVID-19 transmission. It also allows the President to reprogram, reallocate, and realign any appropriation in the 2020 national budget to fund measures to address and respond to the COVID-19. The Senate on Tuesday also passes the Bayanihan to Heal as One Act, or Senate Bill number 1418, which empowers the President to direct the operation of any privately owned hospital and its medical and health facilities as quarantine areas, centers, medical relief, and aid distribution locations, among others. The President's authorized power shall be valid for 3 months unless amended by Congress. Cabinet Secretary Carlo Nograles on Monday said the 2020 national budget should be adjusted to better address the coronavirus disease outbreak in the country. Nograles justified President Duterte's decision to seek for additional power to carry out the urgent measures, such as realigning any appropriation in the 2020 General Appropriations Act, admitting that the government did not anticipate a pandemic while drafting the 2020 budget. He said the current budget is no longer appropriate to respond to the government's efforts to fight the coronavirus. Nograles also said the items in the 2020 national budget could also be used to augment the depleted funds of local governments. The country is currently under a state of public health emergency and a state of calamity. The no mask, no entry policy in some supermarkets, pharmacies, and restaurants is not among the guidelines under the Luzon-wide enhanced community quarantine. Cabinet Secretary Carlo Nograles said the interagency task force does not have any rule pertaining to wearing of masks before entering supermarkets. However, proper social distancing must be followed. Netizens criticized the no mask, no entry policy due to a limited supply of surgical face masks in the country. Moreover, Nograles also reiterated that quarantine passes are free. He said local officials who are issuing quarantine passes for a fee may face maximum penalty for abuses. For those who have grievances against their local officials, you may call the DILG hotline at the numbers flashed on your screen. The DICT warns of cyber attacks on hospitals and other healthcare facilities, and more donations are pouring in to help combat COVID-19. More on this from Lade Kabagani.
Some 100,000 face masks and boxes of bottled water were distributed by the Department of Transportation to several hospitals in Metro Manila to assist those in the front lines of the war against COVID-19. The DOTR, through personnel of the Philippine Coast Guard, gave 10,000 units of face masks and 10 boxes of bottled water each to 10 hospitals in the National Capital Region. The face masks were donated by a Good Samaritan who met with DOTR Secretary Arthur Tugade on Friday. Meanwhile, 2 ambulances were donated to the Philippine Army. These ambulances will be utilized by the Army General Hospital to enhance its medical capabilities in support of the Luzon-wide enhanced community quarantine. These vehicles were officially received from the Lucio Tan Group of Companies and the Jaime V. Angping Foundation Incorporated. In other news, the Department of Information and Communication Technology has called for proactive measures to guard against cyber attacks. Ransomware attacks targeting hospitals and other healthcare facilities are said to be happening worldwide, such as in BRNO University Hospital in the Czech Republic that resulted in the shutdown of the hospital's entire IT system. The DICT Cybersecurity Bureau urged hospitals and healthcare facilities in the country to employ emergency backup systems that would ensure operational continuity for both databases and infrastructure. If such an attack occurs, the DICT said it can be reached through its Facebook page and phone numbers. For the PNA Newsroom, I'm Lid Kabagani.
The Philippine General Hospital is relieved to know that their health workers are free from COVID-19. The hospital has 4,500 employees, including 2,500 doctors. PGH said about 100 of their health workers were considered persons under investigations and were separated and placed under quarantine immediately. PGH earlier accepted the request of Health Secretary Francisco Duque to be one of the COVID-19 referral centers in the National Capital Region. Still to come, Malacanang urges government officials not to use their clout to get ahead on COVID-19 testing. The Department of Health confirms a 51-year-old female as the first COVID-19 case in Eastern Visayas. More on these when the PNA Newsroom continues.
Sa matinding laban natin sa Coronavirus Disease 2019, sugpuin din natin ang pagkalat ng fake news. Huwag magbahagi ng impormasyon na hindi tiyak ang pinagmulan. I-check mabuti ang source ng balita. Kumuha lamang ng impormasyon mula sa mga official channel ng Department of Health. Huwag magpadala sa maling balita, basta't sama-sama at laging handa. Kaya natin to. Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito. Tandaan ang tamang paraan ng paghuhugas at paglilinis ng kamay upang makaiwas sa iba't ibang karamdaman. Basain ng tubig ang mga kamay at sabunin. Unang sabunin ang mga palad at ang likod ng mga kamay. Kuskusin na maigi ang pagitan ng mga daliri at maging ang mga kuko. Isunod ang pagitan ng mga hinlalaki at kuskusin ng paikot ang mga dulo ng mga daliri sa magkabilang palad. Banlawang mabuti ang mga kamay sa malinis na tubig at patuyuin ang mga kamay gamit ang single-use towel o air dryer. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito. Pangalagaan ng sarili laban sa Coronavirus Disease 2019. Hanggat maaari, umiwas sa mataong lugar. Iwasang hawakan ang ilong at bibig, maging malinis sa katawan at ugaliin ang wastong paghuhugas ng kamay. Takpan ang ilong at bibig kung uubo o babahing. Umiwas sa mga taong nagpapakita ng sintomas ng coronavirus disease gaya ng lagnat, ubo at sipon. Magsuot ng face mask kung kinakailangan. Basta't sama-sama at laging handa. Kaya natin to. Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
Politicians and government officials are urged not to use their clout to give them priority for access to COVID-19 testing. Following reports that a number of politicians and government officials got tested for COVID-19 despite not showing any symptoms. Cabinet Secretary Carlo Nograles said guidelines should be implemented for fair treatment. Based on the DOH updated screening protocol, only persons under investigation with mild symptoms, those who are elderly, and those with underlying conditions are eligible for testing. Meanwhile, the Health Department says there will be no VIP lane and that all specimens are being processed on a first-in, first-out basis. In our business news, big companies raised over 1.5 billion pesos to help the urban poor amid the COVID-19 outbreak. Private companies have launched Project Ugnayan, which targets to distribute 1,000 peso gift certificates to over 1 million households in the poor communities of the Greater Manila area. Project Ugnayan is supported by various private companies in partnership with Caritas Manila's Project Damayan and ABS-CBN's Pantawid ng Pag-ibig program. The Department of Health has identified a 51-year-old female from Catarman, Northern Samar as the first confirmed COVID-19 case in Eastern Visayas. The patient was supposed to be discharged from the Eastern Visayas Regional Medical Center in Tacloban City after she recovered from flu-like symptoms. The patient went to Japan and arrived in Manila on January 2nd. She stayed in Green Hills, San Juan for 2 months. She arrived in Catarman, Northern Samar on March 4 and manifested symptoms on March 7. She was admitted to a hospital in Northern Samar on March 10 and was transferred to EVRMC on March 12. And in Pangasinan, 3 more cases of COVID-19 positive are recorded, bringing the total number to 4. Based on the results released by the Department of Health, 2 of the 3 confirmed cases showed symptoms of respiratory illnesses such as cough, colds, and fever. Both of the victims are from Malasiki Town, a 70-year-old male and a 50-year-old female Filipino. Authorities arrested 6 persons in Bulacan and Pangasinan for hoarding and selling overpriced alcohol. This amid the price freeze on commodities due to the COVID-19 pandemic. More on this and other news from the provinces from Ruth Abigita Carlos.
Authorities in Bulacan arrested on Sunday 3 suspects for hoarding isopropyl alcohol and selling them beyond the regular price in Barangay Kaingin in San Rafael Town. The suspects were identified as Marvin Verdillo, Jose Rafael de Guzman, and John Patrick Enriquez, all residents of the said barangay. Undercover police were able to transact online and order 73 plastic bottles of 1-liter isopropyl alcohol for a total price of 16,060 pesos or 220 pesos per liter. The National Bureau of Investigation in Dagupan, Pangasinan also arrested 3 individuals on Monday for selling alcohol at 300% more than its suggested retail price. The suspects identified as Peter De Leon, Jan Lazaro, and Gian Navarro have been hoarding and selling overpriced alcohol in a printing shop in Perez Boulevard. In Cebu City, Mayor Edgardo Labella on Monday distributed 2,000 personal protective equipment to the frontliners in the fight to contain COVID-19. He also announced the issuance of another executive order that requires drivers delivering essential goods such as food, water, and medicines to also wear PPE and strictly implement social distancing. Meanwhile, the Digos City Interagency Task Force COVID-19 and the City Disaster Risk Reduction and Management Council have approved the amount of 3 million pesos for the purchase of rice for the most vulnerable families affected by COVID-19. Mayor Joseph Cagas said, City Social Welfare Development Office will be tasked with distributing 5 kilos of rice to poor families during the duration of the quarantine. In other news, the Department of Agriculture in Davao Region has shifted the registration of Food Pass accreditation through online application. This aims to ensure unhampered delivery of food and other agricultural commodities amid the enforcement of the enhanced community quarantine in the region due to COVID-19. As of Friday, March 20, Food Lane accreditation has already served some 1,250 clients from various parts of Region 11. For the PNA Newsroom, I'm Ruth Abigita Carlos.
Up next, the WHO says coronavirus disease is largely transmitted by symptomatic people. And a psychologist stresses the importance of maintaining relationships during quarantine. The PNA Newsroom returns after these reminders.
Alamin kung paano ang tamang pagsusuot ng surgical mask. Una, hawakan ang mask sa strap at siguruhing natatakpan nito ang inyong bibig at ilong. Tandaan, ang may kulay na bahagi ng mask ang dapat nasa labas. Ito lamang ang tamang paraan ng pagsuot nito. Ihulma ang nose piece o maliit na metallic strip ayon sa hugis ng inyong ilong. Iwasan ang paghawak sa inyong ilong at bibig. Kung marumi na ang mask, hubarin ito gamit ang strap at itapon ito sa isang basurahan. Siguruhin ang maayos na paghuhugas ng kamay gamit ang sabon at tubig. Ang surgical mask ay dapat gamitin ng mga pasyenteng may sakit sa baga o mga taong mayroong ubo, sipon at lagnat, mga nag-aalaga sa mga may sakit, at mga healthcare at frontline workers. Maaari ring magsuot nito kung kayo ay pupunta sa matataong lugar. Basta't sama-sama at laging handa. Kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito. Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaaring gamitin ang braso na pantakip. Kung nakararamdam na kailangan umubo o bumahing, agad na dumistansya sa mga tao sa paligid. Huwag dumura kung saan-saan, gumamit ng tissue at itapon sa basurahan. Ugaliin ang paghuhugas ng kamay at paggamit ng alcohol o hand sanitizer upang mamatay ang mikrobyo. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito. Alamin ang mga dapat gawin sa lugar ng trabaho laban sa Coronavirus Disease 2019. Ang mga kumpanya ay dapat magbigay ng face mask sa kanilang mga empleyado. Bukod dito, magbigay kaalaman din patungkol sa COVID-19. Siguraduhin malinis ang kapaligiran. Maglagay ng sabon at hand sanitizer sa mga palikuran. Siguraduhin ligtas at nalutong maigi ang mga pagkain sa kantina. Obserbahan ang kalusugan ng mga empleyado at katrabaho. Kung sakali man na mayroon silang sintomas ng coronavirus disease, gaya ng lagnat, ubot sipon at hirap sa paghinga, ay agad ipasuri sa doktor. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
The World Health Organization on Tuesday said coronavirus disease 2019 is transmitted largely by symptomatic people. At the Laging Handa public briefing, WHO country representative Dr. Rabindra Abiasinghe said almost 90% of COVID cases are transmitted by symptomatic people. Abiasinghe said the WHO is also looking into reports of those who are infected are manifesting loss of sense of smell and taste. Citing the limited supply of test kits in the country, Abiasinghe advised that these must be used in testing symptomatic people with severe disease, people with pneumonia and acute respiratory distress syndrome, and the elderly with comorbidities or those who have underlying conditions. He said this can help improve the identification and management of the people, as well as in contact tracing and isolating people at high risks. A psychologist in Visayas stresses the importance of maintaining relationships during quarantine. Dr. John Rev Gillaran, disaster clinical psychologist and assistant professor at the University of the Philippines, Visayas, says the current health crisis brings uncertainty to people due to lack of information. He says people experience anxiety because they do not know what is happening and begin to feel psychologically distressed. The anxiety in people may manifest physically. Some experience headaches and back pains, which lead them to think that they might as well be infected with the disease. Gillaran said people can eventually adapt to the situation. Among his advices is to avoid alcoholic beverages and smoking. He also encouraged people to get involved in productive activities like fundraising and making improvised personal protective equipment. He said this situation is not social distancing, but rather physical distancing, as we distance ourselves physically, but we continue to connect socially through texting and calling. He said checking on friends and families from afar also help people cope with the quarantine situation is one way of maintaining good mental health. And in our foreign news, Vietnam has proposed the postponement of the 36th ASEAN Summit, the Asia-New Zealand Summit, and related meetings until the end of June. In a letter to ASEAN and New Zealand officials, Prime Minister Nguyen Xuan Phuc last Thursday said the postponement is necessary due to the COVID-19 pandemic spreading in the region and around the world. The Vietnamese leader thanked the countries for working together with Vietnam. He said the ASEAN community will stand firm in the face of challenges, ensure a peaceful life for its people, and prosperous development of its member countries. Meantime, ambassadors of ASEAN countries pledged to continue working closely with Vietnam to prepare for the 36th ASEAN Summit. The 36th ASEAN Summit, the ASEAN New Zealand Summit, and related meetings are initially scheduled for April 8 to 9 in Vietnam's Da Nang City. And in sports, the Executive Board of the International Olympics Committee on Sunday discussed a possible delay of the 2020 Tokyo Olympics. The IOC is confident that it will have finalized these discussions within the next 4 weeks. The IOC highlighted that significant improvements in Japan strengthened the committee's confidence, but it also pointed out the dramatic increase and new outbreaks of COVID-19 in different countries. IOC President Thomas Bach, however, said the cancellation of the 2020 Olympics is not on the agenda. In Tokyo, Japanese Prime Minister Shinzo Abe said the option of postponement of the 2020 Tokyo Olympic Games is possible if it is difficult to hold the Games as usual. Here is the latest in our community billboard. Those with transportation concerns during the enhanced community quarantine may now reach the Department of Transportation through its new hotlines for free to all PLDT and Smart subscribers. The DOTR, in partnership with PLDT and Smart Communications, launched hotline numbers 8405 5517 to 5524 for inquiries on land, air, or maritime transportation. The hotlines are open from 7 a.m. to 7 p.m. Mondays to Sundays and from 8 a.m. to 12 p.m. on weekends. Let's take another look at today's biggest stories. The House and the Senate approved the granting of special powers to President Duterte to help stop the spread of COVID-19. Malacanang urges government officials not to use their clout to get ahead in COVID-19 testing. And the WHO says coronavirus disease is largely transmitted by symptomatic people. And a psychologist stresses the importance of maintaining relationships during quarantine. Thank you for watching another episode of the PNA Newsroom. To check out more news content, check our webpage or head onto the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also watch us on television on PTV4 and IBC 13. And that's your daily dose of the biggest stories that you need to know. From the PNA Newsroom, I am William Theo. Good day.